Dr. Rita is out tonight, so you have little old me instead. So hopefully I can give you some okay information as far as diabetes and CBD and the brain are concerned. Diabetes is a big deal. We have millions and millions of people who have diabetes throughout America, actually throughout the world. But you'll see we have in America at least 34 million people who have a diagnosis of diabetes. But these are not even all the people. We have so many who are not diagnosed. You know, we live in, especially now, we live in a time when people, for whatever reason, don't trust the doctors as much anymore. And it's a sad thing, really, because doctors have put in a whole lot of time learning the craft that we have. It's a big responsibility to have people's lives in your hands. And I know that there have been some, you know, some who have not lived up to the ethics of it all. But as a patient, your job is to make sure that you have a doctor taking care of you who has your best interest at heart always. So trust the science. The science is real. The science is true. And there's still more, especially now with CBD. Now that it's been legalized and now that we're able to access all things CBD, there is so much that's going to come in the future with healthcare and the implementation of true CBD products from the medical office. So our job right now is to do like my patient did for me. Introduce your physician to the Wakana products, let them see what the products are doing for you, and you probably will have you some great physicians partnering with you to get the products in their office. So tonight we're talking about the role that CBD can play when it comes to diabetes and the effect of diabetes on the brain specifically. So what is diabetes? It is the abnormal metabolism of carbohydrates in the body leading to prolonged elevated blood glucose levels. So that's the medical definition. So in plain English, too much sugar in the body. That's it, point blank. Sugar. So how does that happen? Many different ways that you can end up having a diagnosis of diabetes. But for the most part, when you think about it from an adult standpoint, it ends up being because of our diet and lifestyle. We don't do enough on our own to make sure that our bodies are in the best shape that it can be in. So throughout America, 34.2 million people have a diagnosis of diabetes. But listen, there are millions and millions more who are not even diagnosed because they don't go and see the doctor. But look at that other number, 88 million people have pre-diabetes. So 88 million people have the ability to make the decision to change their lifestyle to avoid becoming diabetics. My question to you is, how many people do you think actually hear they have pre-diabetes and do something about it? Unfortunately, it's usually less than half, unfortunately. And even those that decide to make the change, a lot of times because of where we live, especially we live here in Louisiana, and listen, we like the boudin, a crackling. We have so many dishes that we have just made up that are delicious. We don't want to get away from the lifestyle changes that need to happen because we don't want to give up the taste. But what we need to keep in mind is it's the taste that is actually causing our bodies to suffer. It's the taste that keeps the sugar up. It's the lack of exercise that keeps the sugar up. Simple lifestyle modifications can do it. For those 88 millions of people, they can go back to being non-diabetic if only they make the lifestyle modifications that they need to make. So there are three different kinds of diabetes, for those who don't know: type 1, type 2, and gestational. So type 1 diabetes, usually we see this in kids. Typically, you're going to be under 19 if you have type 1 diabetes. This is an unpreventable thing. It's an autoimmune disorder. The body attacks the beta cells of the pancreas, which is where our insulin comes from. It attacks those cells, destroys them, and therefore that person is absolutely unable to make insulin. That being said, the only way to treat type 1 diabetes is with insulin. And so we've seen kids as young as 2 and 3 years old who are insulin dependent diabetics. And this is something, again, that they have no control over. It is unpreventable, autoimmune. Type 2 diabetes, however, is completely preventable on many, many levels. Usually you see this in adults. It may or may not require insulin. I have a lot of patients who think that because they've been started on insulin, that they have switched over to type 1 diabetes. It doesn't work that way. They are type 2 diabetics who need insulin for treatment. But still, type 2 diabetics, typically because they're overweight, or because they have very poor eating habits, or because they're very sedentary. They don't do much exercise or activity at all. Now, gestational diabetes, on the other hand, is only seen in pregnancy. If you have gestational diabetes, does that mean you're going to be a diabetic? Not necessarily. It again boils down to the lifestyle modifications that you decide to make. If you get to business, you're eating healthy, you're exercising regularly, the chances are very high that you can prevent yourself from moving on to become a true diabetic. What are the signs and symptoms of diabetes? So if you look over here on the left side, these are actually more of the signs and symptoms that you're seeing with the type 1, with the kids. They're eating all the time, but they're still losing weight. They're really, really, really tired. And a lot of times they just feel weak. Most of the time we're diagnosing kids really because of the weight loss. You start to see such a drastic drop in their weight, but you're seeing them eating over and over and over again. It's almost like they're a bottomless pit, but they're steadily losing weight. That is a sign that you need to get them into their doctor to be tested for diabetes. But over here on the right side, this is what we mainly see in adults, in type 2 diabetics. There's excessive urination, polyuria. They're going to the bathroom a lot. As a matter of fact, nocturia, which is going to the bathroom in the middle of the night. Most diabetics will wake up 3 to 5 times a night, maybe more if the sugar is really high, to use the bathroom. So that is one very, very strong clue that somebody might have diabetes. Polydipsia, drinking a lot. Non-healing wounds, a wound that just seems to not want to completely heal. Peripheral neuropathy, getting numbness, tingling, or pain in the hands and feet. That is a big thing. And multiple frequent infections, especially yeast. Yeast infections are very, very common, where it's the genital yeast, mainly because one of the ways the body tries to fight diabetes is by getting rid of it through the kidney and the urine. But the more you urinate the sugar, the more chance you have of becoming prone to having yeast infections or mycotic infections from a medical standpoint. Also thrush in the mouth. People who have thrush, it's also another thing that you want to immediately look for is, do I have diabetes? So these are just different ways that it might show up. Typically on both sides, type 1 and type 2, you could have blurred vision. So pay attention to your body. Changes across the board for sure with the drinking excessively, urinating excessively, or waking up in the middle of the night to go to the bathroom, you need to make sure that you're getting yourself checked to see what your blood sugar level has been. So diagnosing diabetes, we look at something called an A1C. So the A1C is something that stays in your blood for about 3 months. And based on that A1C, it's going to give me an average of what your blood sugar has been over that 3-month period of time. People who are not diabetic at all have an A1C that is less than 5.7. From 5.7 to 6.4, you're considered borderline diabetes or pre-diabetes. 6.5 and higher, you are a diabetic. So that's just using the blood test, the A1C, which is actually how we also follow how well your blood sugar is being controlled. And actually, just something to take note of, I am also a DOT physical medical examiner. What was happening with the DOT drivers, they realized that if they fast before they go in to do their DOT physical, that the blood test, if they're only checking for the sugar, would show that their sugar was under control. So of course, the powers that be realized that, and they switched it to checking this, the A1C. So even if they try and fast for 2-3 days before, it still won't change what that A1C is, because remember, the A1C gives me an average of your blood sugar over a 3-month period. So that was just a way that the truck drivers were trying to get over, but not anymore. Another way to diagnose diabetes is by the fasting plasma glucose. So this is blood testing now and checking just the sugar. So if your fasting sugar is greater than or equal to 126, then you're considered to be a diabetic as well. There's something called a glucose tolerance test, where you're given a certain amount of glucose to drink, and then your blood sugar is tested 2 hours after. Your body should be able to metabolize that concentrated sugar. And so when they check 2 hours later, your blood sugar should be under 200. And if it's not, if it's 200 or higher, that also gives you a diagnosis of diabetes. Now, this is what's used mainly for a lot of our pregnant women to find out if they're at risk of gestational diabetes or not. And then if anybody has any symptoms, a random blood sugar check is over 200, at or above 200, that will also give them a diagnosis of diabetes. So these are the different ways that you possibly can be diagnosed, different ways that we can treat diabetes. Lifestyle modification is the first place we always want to go. Every single diagnosis, almost every single diagnosis that I can think of, lifestyle modification is always the first plan across the board. You want to diet, you want to pick healthy choices. And for most people, it ends up being that I tell people to start off, just eat clean. Give up the fast foods, or, keep it to maybe once every 2 weeks. Give up the fried foods, or keep that to only once every 2 weeks. But you want to start off, take an inventory of what your diet consists of most commonly, and make those little changes that you need to make. And I'm not going to tell you to do it cold turkey. You just need to cut it all out. Because a lot of times I've realized that just doesn't work for people. And when you try to do it cold turkey, it can be a bit of a shock, and kind of the body rebels, and you end up wanting it, and you're just ravenous for it. Well, slow and steady. Take away the fast food first. Then take away the fried foods. Then switch from drinking soda or juices all the time to drinking more water. Gradually shift over to more healthy options. And that gradual shift will help you to be much, much more successful. Exercising 3 to 5 days a week for 30 minutes. That's it. I don't have anywhere to walk. It's too cold. It's too hot. It's rainy. You can literally walk in your house up and down a hallway for 30 minutes. That is still exercising. If you go on YouTube, there are tons and tons of exercises that you can do at home. Look, there's yoga, there is line dancing, there are weights, and you can use canned goods for weights. You can use the rubber bands for actually resistance if you're trying to do something with barbells. But there are tons of things. Even if you're not one who can be up a lot, you can do a bunch of seated exercises, and those seated exercises are just as effective. And start wherever you are. So I say 3 days a week for 30 minutes. Let's say you can only do 2 days a week for 15 minutes. Start somewhere. Starting somewhere is definitely better than not starting at all. But then every couple of weeks, you want to work your way up to adding maybe 5 more minutes or adding another day. But lifestyle modifications is always the first line of treatment for mainly things like diabetes and high blood pressure, for sure, is the way to get you started. The next thing that we can do is add an oral glucose lowering medication, which, you know, we have tons and tons of pills that we can prescribe for you. We also now have a once a week injectable, which is not insulin, but a once a week injectable that slows your gut, helps with lowering your sugar levels. And then there, of course, is insulin that we can use. Remember, insulin is what we use across the board for everybody that's type 1, because it's an autoimmune disorder and the pancreas beta cells are just not working. They've been damaged. But type 2 diabetics, lifestyle modifications, oral glucose lowering pills are added. The GLP-1 probably will be added, and then insulin if you're still uncontrolled. But I can tell you the majority of patients, adult patients who are uncontrolled because they refuse to implement lifestyle modifications. So just keep that in mind, especially when we go to the complications. And number 5, CBD. Does CBD have a place when it comes to diabetes? It actually really, really does. There have been studies that show that CBD, because it's a very strong anti-inflammatory, it reduces inflammation in the pancreas. And as it reduces inflammation in the pancreas, it also allows for the upregulation and increase in mass of the beta cells. So when that happens, we have our own pancreas able to produce more insulin than it was before. And that is how it helps with lowering the blood sugar. Now, that CBD alone, add some black seed oil to that, which also helps to upregulate the beta cells. Then we have a good formula for helping our blood sugar levels get to be much lower. But we're going to talk a little bit more about CBD in a minute. Complications. Look at all of these complications. You know, my uncle once told me, I was watching him, I know he has horrible diabetes, but he was sitting there eating peppermint after peppermint. And I said, dude, you know, that is just really harming your body. And he said, you know, y'all doctors don't know everything. We need a little sugar. Well, let me tell you, if you are one of the people who thinks that way, you already have way more than a little sugar in your body. The problem, the higher that sugar is and the longer it stays at that high level, the longer you allow it to damage the nerves that go to your eyes, your brain, the ends of your extremities, your hands and feet, your heart, your kidney, your blood vessels. I mean, diabetes is a very, very prominent cause of people losing their eyesight. I wanna share with you, I actually had a patient one time who knew he had diabetes, but didn't take his medicine because he didn't feel bad. And that's a problem because these are silent killers. You don't necessarily feel bad when it's going on. He is at a crossroad in his vehicle, waiting to cross the street. He looks to his left, he sees a big truck. He's waiting on the truck to pass. It's clear over here. He starts going across and bam, gets T-boned because there was another vehicle there that he did not see because he didn't realize he had already lost his peripheral vision. Well, by the time he's in the ER and they're doing a workup on him, he's already in some heart failure. His kidney function is already down. He had no idea that that was going on. So what I try to get people to think of the sugar as, think of that high sugar as termites. On the surface, you look beautiful. On the surface, it all seems to be wonderful. But underneath the surface, what kind of damage is that sugar causing? So vision loss, diabetics, vision loss is something that comes from diabetes in a high percentage of our people who have vision loss. The issues with the hands and feet and the blood vessels. People who have amputations very likely are diabetics because the diabetes is going to affect the blood vessels, cause them to become so inflamed that they get blocked, so the blood cannot proficiently get to the bottom of your legs. And that's why a lot of amputations happen. So kidney function, same thing. When you're talking about the sugar affecting the kidney and damaging the kidney to the point that you end up on dialysis, that's a big thing. But those are normally not things that you're gonna feel from the beginning. These are not things that you're gonna know are happening until they are irreversible. Typically, when you start to have symptoms from diabetes, those symptoms will pretty much be at the point of being irreversible. But why wait? Why wait until then when you can implement some measures here and now to get your sugar levels under control and prevent all of these complications from happening? Well, what I've found in my research is CBD plays a big role in these changes as well, because again, CBD is a very, very strong anti-inflammatory. So I found some articles actually that were talking about the effect of diabetes on the brain, which I found to be really, really interesting. So we know that diabetes in general, it sets off a very strong inflammatory cascade throughout the body. It can damage all of these different organs. So whenever you're thinking about the brain, we know that diabetics are at a much, much higher risk of having heart attacks and strokes because of that inflammatory process that's going on. So in a study that was done with animals, they showed that rats who were given sugar to the point of them being considered diabetics, when oxygen levels were reduced to the point that they became oxygen deprived. So they're simulating what happens when strokes happen. The diabetics had significantly increased levels of memory deficits, cognitive deficiencies than the other rats. So just simply having diabetes alone made it extremely more a worse entity for them, for those who had the lower oxygen levels. So when the same issues are happening, but you add CBD to it, the same study showed that when CBD is on board, same circumstances, diabetics, oxygen level is dropping, CBD literally protected the brain from the damage that was actually seen in those who were not taking CBD. So when you look at the brain up here and you see the blue area that's representing some injury that occurred to the brain, you saw that injury in the rats who had diabetes but no CBD, but the rats who had CBD, even though they had the oxygen deprivation, even though they had all the same things going on, simulating what would happen when people have strokes, they did not have damage to their tissue. That is a major thing. And you know, all of these studies, unfortunately, have only been done on animal subjects. However, that is really where all of our studies begin. We start with animal subjects and we move on to the human subjects. I don't see this being something that's going to be long in coming, actually. I believe that in the near future, we're going to see more studies with people and CBD, and we'll be able to truly be able to say it heals or it prevents. Right now, what we can say is I can see in my patient that it has helped this, that, and the other. But this study here this was just an amazing study to me, and I hope you see what I mean, to see that to have a situation occur where you typically would have damage to your brain, but because you're taking CBD, it is protective. So if that study showed that the CBD protected the rats' brains who had diabetes and had the decreased oxygen, such as what you would see with a stroke, don't you think that the same thing would happen throughout the rest of the body? Don't you think the CBD will also protect the heart from being damaged or the eyes from being damaged? So we are still seeing only the animal studies. However, these animal studies give us so much promise about how CBD can be protective for us. So remember, the CBD itself is a very strong anti-inflammatory. So it is going to reduce the inflammation. Inflammation is what ends up causing ultimately the damage that we see in all of these different areas that can be caused from the sugar being too high. Now, we want your sugar to be under control. We're not saying, if you just take CBD, then, you're good. We want it all. We want the best protection for our bodies. So we want better sugar levels, but we want to also maintain our regular use of the great Wakana CBD products as a way to protect our organs from damage that we may not even know is going on. Because remember, consider sugar just like you consider termites. Everything might look great on the outside, but Lord knows what's going on the inside. But great, great study to show us how CBD can be protective. So here, when you think about the brain one more time, CBD definitely supports our brain health. It is a very strong anti-inflammatory. It's also neuroprotective, meaning it protects the nerve fibers in the brain. When it's protecting these nerve fibers, there are things that might be going on all around, like the oxygen level might be down, such as what happens with a stroke. But even though that is happening, it is still protecting the nerve fibers from truly becoming damaged. And actually it was the same thing with the heart. When I looked at the studies, when I did the hypertension one, it was the same thing, that when CBD was on board, CBD protected the heart from the damage. So even though a stroke could happen, even though a heart attack could happen, having CBD on board that is protecting the muscle is a very good thing, because the muscle does not end up damaged for life. That is what we want. We want the protection that CBD provides to our muscles so that we don't have the lifelong complications that can happen from having heart attacks and strokes. And it's also a very strong antioxidant. So non-psychotropic, but health without the high, health without the high. So again, it's neuroprotective. That is how it helps with the brain. But think about other things, multiple sclerosis, neuroprotective. So somebody may have multiple sclerosis and they might be right there. They've progressed to, let's say, level 2. But having CBD on board, based on this study with the rats, says that there is a high potential, a high likelihood that the nerve fibers from then on out are going to be protected, so there won't be additional nerve damage than what is already there. Dementia, same thing. As a matter of fact, when I was looking at the studies showed that there are truly plaques that build up in patients who have Alzheimer's and dementia. And there are studies suggesting, still animal studies, but still Studies suggesting that these plaques are CBD helps to get these plaques removed so you don't have the buildup and the progression to worsening Alzheimer's. So very, very good things in the work when it comes to CBD and how it protects our organs. Again, strong anti-inflammatory, neuroprotective, and that is why we want to make sure that we have our regular dose so that we are protected as much as we possibly can. So that being said, let's talk about what kind of products and the wonderful products that we can add to our own regimen right now that can potentially give us that protection that I've been talking about. Wakana has done its due diligence in making sure that we have products in every industry. As you can see here, we have the pain cream, we have oral drops that we can ingest, but we also have products for the hair, seasonings, we have protective products for COVID and germs or against COVID and germs, and we have a full sexual wellness line as well. So first thing that I want to mention is that we have both a pure line and a power line. Power line has up to 0.3% THC, which is federally legal in all 50 states. But there are some of us who, because of the jobs we have, like offshore workers, some healthcare workers, teachers, who can't take THC at all, even though it is legal in all 50 states. You would want the pure line. With the pure line, Wakana does its job of extracting as much of the THC as it possibly can so that it has 0.0% THC. So the pure line is safe for anyone to use if you have to do random drug testing. But if you don't, then the power line is for you, because even with that little bit, that 0.3% THC, it binds with the CBD and helps the CBD to work at its highest properties. So the first products we're going to talk about are the different kinds of products that we can get in the power line. First up, we have the Hemp MD. Power Hemp MD, it's the strongest tincture or oral drop that we have with Wakana. You want to start off with 3 drops under your tongue, let it sit there for about a minute, and then swallow. Usually these tinctures, the oral drops, will be at a peak at about an hour after you've done that. And it lasts about 4 hours. This we use for any chronic issue you can have going on, insomnia, anxiety. Actually now in my practice, I am using this more for patients who have high blood pressure and diabetes, because I have been seeing a tremendous drop in blood pressures and improvement with blood sugars because of it. The next thing we have are the power gummies. So our gummies are infused. That's what sets Wakana apart from everybody else. We want to compare gummies. Look, do not be afraid to compare the Wakana gummies to anybody else's, because these are infused. They pack some power behind them. So you always want to start with 1/4 of a gummy and work your way up. Start slow and you can increase. If you take too much, you can't take it back, but you can always increase if you start with that 1/4 and you find that it's not enough. But the gummies are different again because they are infused. But when you take the gummy, they will reach their peak at about 4 hours and they will last for about 8 to 12 hours. The premium flower is a smokable hemp. The smokables are the fastest way to get it into your system. Whenever you smoke the hemp, it'll get into your system in about a minute. So when you're talking about acute things, panic attacks, anxiety attacks, or even acute pain, you twisted your knee or your ankle, the smokable hemp is the quickest way to get the CBD into your system and working on the problem that you have. So remember, all smokables only take about a minute to get into your system, lasts maybe about an hour or so. And then the Power Extreme Pain Cream, which I like to refer to as the miracle cream because it has not failed me yet. This cream you can rub on any area that hurts, any joint, any muscle. I have used this pain cream on the temples, and it's helped with headaches, especially sinus headaches. I've even used it on shingles after the rash has cleared. I've used it where that shingles pain continues to linger and reside, and it's helped that as well. The pain cream pretty much is going to start working in about 5 minutes. It probably peaks in about 15, and it'll last. Different people I'm finding, but anywhere from 1 to 3 or 4 hours it can last. So these are the different types of products that you can use for chronic issues. We really recommend something called layering when you have chronic pain, chronic conditions like high blood pressure and diabetes. Layering ensures that you have the CBD product in your system at all times. So for example, if you're doing the drops and the gummies at the same time, and the flower, you know, the flower is going to be in your system in a minute. It might last about an hour. Well, the drops will be kicking in an hour and last about 4 hours. At that point, the gummies are kicking in and they will last about 8 to 12 hours. So if you do that twice a day, that allows you to have a continuous, steady stream of CBD in your system that will help with that chronic condition that you have been suffering with. We have a full assortment of gummies that you can choose from, but we have some high hitters here. This King of the Jungle, the KOJ, this is a hot commodity. This is the main product of our sexual wellness line. The King of the Jungle, which should also be given a Queen of the Jungle name as well. This helps with libido and stamina, and this is something that men and women across the board love. If you know of a couple who's having an issue with their sex life, or if you just want to spice up your sex life, this is the perfect product. And Dr. Rita mentioned some weeks ago that she actually started gifting this for weddings. And I thought that is such an amazing idea. A way to spice up the honeymoon? Well, shoot, yes, indeed. But supplements in the King of the Jungle that will boost your libido and stamina, spice up your sex life, but it is a power product. So if you have to do random drug testing, you don't want to do the King of the Jungle, but everyone else, have at it. Go on and have fun. Next one up is the Flight Delta 8, and you see the caution sign on top of it because it is our product that is the closest related to the real deal, the real THC. But it is still one of the cannabinoids that is legal in all 50 states. Well, with the Delta 8, it is the strongest that we have, but it gives you that focus, that creativity. I remember one of my customers, she said, I can't believe, she said, I've been having so many things on the fire that I haven't been getting done. She said, but since I started with this Flight Gummy, she's like, Dr. Kim, I'm getting it done. I'm getting multiple things done throughout the day. And that is what I hear over and over and over again. So if you're looking for something to help with your creative mind, or if you have those flighty thoughts, you know, that inattention, the ADD, inability to remain concentrated on one thing at a time, this also is a product that can help you with that focus and attention. Again, if you've had trouble with THC, then you want to kind of steer clear, but everyone else, great product for creativity. Next up, we have the Pure Gummies. Remember, 0.0% THC, safe for everyone to use, especially those who have to do random drug screens. And it will help with insomnia. It will help with stress and lowering your anxiety. Taken in the middle of the day, it actually can help with your energy level. Because remember, the whole deal with CBD is that it's going to give you balance wherever you need it. So if you take it at night, it's going to help you have a more restful, deep sleep. If you take it in the middle of the day, it's going to help you to have that little boost and give you the energy that you're looking for to get through your day. And here again, we have the Power Gummies. Sleep, inflammation. Those gummies, you always want to start with 1/4. Don't forget 1/4. But for the most part, the Power Gummies are definitely going to give you that REM sleep, that deep sleep that you're looking for, so you can wake up the next day feeling good and refreshed. Wakana has a full, some culinary products that are absolutely amazing. We have 3 different types of seasonings that you can add to your foods. We have some drops here that are infusible into your foods and your drinks. And we have some CBD butter down here that goes great with your breads. We have the Royal Defense line, which is great, great, great right now because we still have the funky COVID going on, unfortunately. But Wakana has made sure that we have products that protect us in every aspect of our lives. So we have products like the First Defense nasal spray that, as my daughter puts it, it helped instantaneously with the nasal congestion. She is a chronic sinusitis person. Sure enough, when I did have the congestion, it works pretty much immediately and works very, very well. There's also Essential Defense, which you put it on your toothbrush and it helps with the germs throughout the mouth. But there's also stuff for hard surfaces. There is something for your hands like Purell. There's Produce Wash here for your fruits and vegetables. Please be washing fruits and vegetables every time you buy them, because you never know whose little nasty hands have been on those products in the stores. But all of the products in the Royal Defense line are all alcohol free. They kill 99.9% of the germs, work up to 24 hours. So great, great competition from Microban, but they're lab certified and they're all natural. Wakana even has its own line of essential oils because everybody knows how the essential oils have been such a great addition to our lives and helping with different medical issues. The one I want to highlight is the black seed oil, of course, because it has so many wonderful properties. I already said it helps with upregulating the beta cells in the pancreas. So it helps with lowering sugar, but it's antibacterial, antifungal. So many wonderful uses for black seed oil. My husband actually had a tooth abscess and it was over the weekend, so couldn't get to the dentist. And so of course we're like, okay, well, look, try the black seed oil on it. And he felt so much better. The black seed oil dulled the pain that he was having. So great uses for black seed oil. These essential oils are phenomenal. Here we have the rest of the smokables. We have pre-rolls. There is also the Flight 300 pre-roll available now. And then we have the Raspberry Jane and the Hypnotic. Remember again, it's the fastest way for CBD to get into the system. Any smokable can get into the system in as early as 1 minute from the time you do your first puff. So a great way for treating, or let's not say treating, or helping people who are having anxiety attacks or panic attacks or an acute pain because they twisted something. Here you see the full sexual wellness line. Again, the king of the jungle, we talked about already, but there's a G-Spot lube. There is a Cherry Bliss that, as I learned a few weeks ago from Dr. Rita, is edible. So talk about spice up that sex life. There's the spice right there. You have some body butter and that oud body oil. Let me tell y'all, I still love the oud body oil because you use it on those rough areas like your feet, and you will be pretty amazed at how well it works. But we have a business partner who had poison ivy, and she said she put everything she could, but she put some of that oud body oil on that area, and she said the itching stopped almost immediately. So great uses for this oud body oil as well. We have our weight loss line because everybody and their mama and their daddy and their grandparents, are looking to lose weight. And as I always say, even the skinny people want to lose weight. But we have a great line of products that helps with weight loss. And we do have our flat belly challenge still going on now. And get with the person who invited you to this meeting to learn all about the flat belly challenge, because you could win a free trip to Jamaica. You could win $1,000, $500. Who can't use this extra money right now? But in that weight loss line, We have the bitters, which is the bitters tea. It's a detox tea that helps to cleanse the colon, because healthy weight loss starts with a clean colon. Removing the toxins, getting the great balance of good and bad bacteria, which is going to promote our metabolism and promote the absorption of the good substances, nutrients, and supplements that we need. We also have the Flat Belly Brew, which is our coffee. Tastes great, has Garcinia cambogia, which helps with the prevention of too much fat storage, and green tea, which boosts the metabolism, that combines with the CBD to give healthy, good weight loss. And then the Flat Belly Gummies, which has the Caralluma fimbriata, that helps with appetite control. Something that actually was used decades ago for people who had to take long trips to help with their appetite. Well, we have that product in the Flat Belly Gummies that you take before your meals, and it helps with making better decisions. It helps with preventing you from overeating. But those three products together, you get good, healthy weight loss. Again, ask the person who invited you to this meeting all about the Flat Belly Gummy Challenge so that they can get you to that page. And we also have the Immune Defense Tea, which we want to boost our immune system, right? Especially with COVID still being a heavy hitter right now. So all that we can do to boost the immune system, we want to do. So adding the Immune Defense Tea is another way for you to do just that. And our King T'Chaga, this is the heavy hitter right here. This King T'Chaga has the chaga mushroom, but look at all of these health benefits. First and foremost, it's our only capsule. So for those who potentially may not like the oil under the tongue or don't want the gummy, you have this capsule that you can swallow. But it has strong anti-inflammatory properties. It's antibacterial, anti-tumor growth. It also boosts your immune system, but it lowers blood sugars and it helps lower cholesterol levels. So this across the board, it packs so many wonderful properties that if you're someone who is suffering with high blood pressure or diabetes or high cholesterol, you want to incorporate the King T'Chaga into your daily regimen so that you can get all the benefits that this capsule has to offer. And last but not least, we have the healthy hair. Hemp Power Hair. I cannot even say enough about this product because I had a lot of stress a couple of years ago. And it ended up with me losing my hair here in the front. And I've tried different products, nothing really worked. I just learned to comb my hair in such a way that no one could see it. Started with Wakana and learned about the Hemp Power Hair, and I started putting those drops on my edges every morning and every night. And I kid you not, within the month, I could see a difference. And this, I mean, to tell you, it's miraculous because I just kind of thought, okay, I was going to be stuck here forever. Well, I actually have another business partner new to Wakana who showed us pictures of hair loss at the crown of her head. Only a month ago, she's been using the Hemp Power Hair for 1 month, and you can already see a remarkable difference. So that is one thing. For men who are looking to have a fuller, healthier looking beard, there's the beard and scalp oil. But adding to that, the SOS hair care system, Save Our Strands hair care system, you cannot beat it. This combination will make your hair healthier. It will make your hair stronger. It'll make the hair follicles healthier so that you're producing healthier, longer hair. And you won't see as many strands on the floor. You will be able to see thicker, healthier looking hair. And in this SOS hair system, you get the shampoo, the conditioner, the leave-in detangler, the cream, and the oud body oil, which adds shine to the hair, all in one package. But again, it leads to healthier, longer hair, less shedding. And you will get back your crown of glory that you potentially have lost. So this concludes the presentation today. I pray that you got some good information from this. And I am going to go up here and see what kind of questions we have. But if you, I don't know if you can unmute. I don't think you can. Thank you, Ms. Gia. Thank you, Ms. Lisa. Let's see. Thank you all. Any questions? Yes, neuroprotective, Miss Erica, absolutely. Yes. It's amazing. Yeah, it's amazing what diabetes can do to people. It's of all the different medical issues we can have, diabetes is definitely amongst the worst. Because truly, diabetes can mess up, it can injure, damage all the organs in your body. And the bad thing is you can not go to the doctor. How many people do you know say, oh, I don't go to the doctor, I always feel great. And then lo and behold, all of a sudden, bam, there it is, something happens where they can't see, like the patient I was telling you about. He had no clue. He lost his peripheral vision at all. Oh, we have some questions. Is there CBD in the hair products? So there is CBD in the hemp power hair. Not in the SOS hair care system, that line headed by Ms. Doris Mosley. Has other essential products in it that helps with the hair growth, the follicle growth, making the hair stronger and healthier. But the hemp power hair drops do have CBD in them. Talk about the properties of the pure hempranium. So the pure hempranium will do all that I have said. One of the things that I find to be most helpful is understanding that our organs have receptors for CBD. So at one time it was thought to be about 10. Now we know that it's way more than 10. But our organs have receptors for CBD. We naturally make 2 different kinds of CBD. So when you ingest CBD, it will literally look around and see where it's needed. So whether you're taking pure hempranium or power hempranium, when you take CBD at bedtime, pure or power or flight, it'll help you to have a more restful, deeper REM type sleep. It will help with anxiety. It will help with stress and depression. It will help with pain. So it's not that the pure, because all the THC is as much of the THC as possible is out of it, it doesn't mean that it doesn't work for all of these different symptoms. You may need 6 drops of the pure hempranium, whereas with the power, I might need 3. The difference will be in how much of the pure you're taking, but it is just as effective in helping these different symptoms we've talked about. So hopefully, Ms. Sandra, that answered your question. Silent cardiac issues and with diabetes, you know, people who have diabetes do have silent heart attacks. People who have diabetes, they will affect nerve endings and damage nerve endings. So feeling, sensation is blunted. So you can have, that's why diabetics, a lot of times when you see people who've had amputations, very likely what has happened is they had some kind of cut or wound and it did not heal. They had no idea it was there. I make a point now for every single diabetic patient that I see, I check their feet every time I see them, but I tell them that needs to be a regular part of what they do every day. You take a bath or shower and you literally lay eyes on your feet to see if anything is going on. There have been so many people who've had things, amputations, because they did not look at their feet, They had no idea something was stuck in their foot. They had a sore or a wound that wasn't healing and getting worse. So diabetes damages, but the damage is done so subtly, you don't know. If you just all of a sudden have a big damage to your kidney or your brain, you're gonna feel that. If a big portion of it is injured, you'll feel it. But what diabetes does, again, remember, think about termites. That sugar is under there eating away at the kidney, at the heart, at the brain, at the extremities. And it does it in such an insidious manner, so gradually, you don't realize it's going on until all hell breaks loose. Then, once you have symptoms like that, typically whatever is going on is at the point of being irreversible, though. So yes, there are many diabetics who have had silent heart attacks. No idea they had a heart attack, but it did happen. Part of the heart is damaged, but we might not know it unless they come in and they've started having swelling. So we're trying to figure out where the swelling in the legs is coming from. So then we do an echo, and then lo and behold, we see part of the heart is not contracting like the rest. So plenty of folks have these silent cardiac issues, and that's the why of it. What time of day is good to take King T'Challa? You know, any time of the day. I literally take it just in the morning and just get it over with, because I don't like swallowing pills. So I just take them in the morning. If you need to space it out during the day, you can, but it doesn't matter whether you take in the morning or in the evening. Do statins tend to contribute to a person becoming a diabetic? You know, there were some things that came out now saying yes, possibly Lipitor, and Lipitor was like the major one that they were talking about. But I always say you need to make sure you have a very good relationship with your doctor. And so if you're new to a statin and all of a sudden your blood sugar starts rising, then we know cause and effect. For the most part, that is not a real thing. And for the most part, there is not a true study that proves statins absolutely do that. But there has been talk, yes, about possibly Lipitor increasing the blood sugar level in some people. That is a true thing. But again, like I said, you want to cause and effect. If you're on a statin, we can check and see 3 months later, has there been an increase in your sugar that we need to be worried that the statin is the thing causing it. Miss Tadisa, which CBD is good for bipolar, PTSD, schizophrenic? So mental health, different symptoms dealing with mental health. Okay, I'm sorry, I tried CBD Power, water soluble for 2 months, but I see no change in my daughter as yet. She talks and laughs uncontrollably. So first I wanna say that please make sure that you are talking with your doctor and getting your doctor's input about this, because you don't wanna just, push the doctor out, because there is some absolute truth in the science. But what I want to say is make sure you're layering. You remember I talked earlier about layering, in a situation like this, if it were me, I'm not telling you what to do, because for sure you should check with your doc. But if it were me, I would definitely want to layer what I am doing, and meaning I would do drops and I would do gummies to ensure that I have a working amount of CBD in my system throughout the day. And you start low and you slowly increase. So if you're starting with 3 drops twice a day, then you slowly increase to 6 drops and see how that does, and 9 drops. We have a maximum of 15 drops twice a day that we can reach. And so, you want to start low and slowly increase. Same thing with the gummies. You want to start with a 4th twice a day maybe, and see how that works and kind of go from there. But layering for sure for chronic disorders is where you want to be. just something just at night or something just in the morning is not going to work for that. But try, talk to your doctor. And if you're using these products, again, you want both drops and gummies together night and day, and you want to start low and slowly increase until you maybe see some difference in the symptoms. Hopefully that answered your question, ma'am. Let's see, what else? Things. Sarcoidosis. Is that what you mean? Sarcoidosis? Lung disorder? You know, Dr. Rosado actually, Dr. Rosado was on with Dr. Rita a few weeks ago. I believe he has sarcoidosis because I saw one that they had done some years ago, and he talks about it. So since as a distributor, that would be a good one for you to look at, but he actually talks about using the vapes. Because remember, the lungs do have CBD receptors as well. So being able to get the CBD to the lungs will help reduce the inflammation. Sarcoidosis is an autoimmune disorder, causes a lot of inflammation in the lungs and actually other organs as well. But the CBD's purpose here would be to help reduce the inflammation. So it could be helpful. All right, and that's all. Oh, I have 2 questions up here. I know sugars are bad, but how important are carbs in the diet? Now, as a diabetic, you want to stay under 60 grams. Under 60 grams. And the best time of day for the King T'Challa, we covered that as well. All right, so hopefully this has been informative. If there's anything else that I've missed, want to add anything, Dr. Betty?
Yes, just one little thing. Excellent presentation. You were so on point with everything. One little thing that I would like to say, though, is that yes, our SOS Save Our Strands products do have CBD in them. Okay. They do.
All right. See,
the shampoo has, has 100 milligrams. And, yeah.
All right, ever learning. So I am corrected. Thank you very much.
No worries. But the one thing to remember about it is topicals do not cross the blood-brain barrier. So even if you are drug tested, you don't have to worry about being positive using the shampoos, conditioners, that kind of thing.
Ah, wonderful. Thank you so much.
Thank you
very much. So thank you all. Thank you. I really appreciate your presence. Thank you for taking time out of your evening to be here. And with there being no more questions, I will say good night. And thank you, Dr. Betty.
Thank you,
everybody.
Thank you. Wonderful, wonderful presentation.
Thank you, ma'am.
Bye for now.